All right, good evening to everyone here, and welcome to tonight's health talk. My name is Christine Vihishima, and I am your, will I say, host, moderator for tonight. I am the programs officer at Well Life Foundation, Abuja. If you can hear me, please, can you give me a thumbs up? If you can hear me, can you give me a thumbs up, or can you let me know in the comments? Great. You can give me a thumbs up. Thank you. Amazing. Blessing can hear me. Great. Lily can hear me. Shewun can hear me. Beautiful. Thank you. Thank you so much. Great. So we are good to continue. And I'd like to welcome us to the very first Well Life Health Talks series. The Well Life Health Talk series is a series of health talks hosted by Well Life Foundation and Well Life Hospital in Abuja, both of which are very, very passionate about promoting healthcare in the society. And this very first session, we're very excited about it because we're going to be talking about a very interesting topic that isn't often talked about but affects each and every one of us in some way. So before we begin, I will give us a little background into World Life Hospital and World Life Foundation, and then I will go ahead to introduce our speaker for tonight. So World Life Hospital is a hospital based in Abuja, and we are very passionate about helping you achieve your reproductive and gynecological goals. And we specialize in areas of infertility, gynecology, minimal access surgery, and we have a team of highly skilled and experienced professionals waiting to attend to your medical needs. Now, for Well Life Foundation is the baby of Well Life Hospital, and Well Life Foundation is a non-profit organization that offers medical health services with excellence to the underserved, most especially. And we offer services like direct medical services, preventive health and health education, fertility treatment and fertility education, capacity building and infrastructure development, advocacy and policy change, and of course, general community health-based interventions. So on behalf of Well Life Hospital and Well Life Foundation, you are highly welcome to our very first Health Talk series. And tonight we are going to be talking about understanding your fertility, myths, facts, and medical realities. And to take us through tonight's session is our very own chief and executive director of Well Life Foundation and the hospital, Dr. Ibrahim Yakub Sime. Now, before he joins us or before he goes live, I'm going to take a few moments to read his bio and then we continue. So, Dr. Yakub Ibrahim Sime is a renowned gynecologist and obstetric surgeon with over 2 decades of experience in the medical field. As the founder and CEO of Well Life Hospital and the executive director of Well Life Foundation, Dr. Sime is dedicated to providing high quality healthcare services and improving the lives of patients across Nigeria and beyond. He's a fellow of the International Fertility Society and a member of the West African College of Surgeons, Obstetric and Gynecology. And Dr. Sime is a skilled gynecological minimal access surgeon. Throughout his career, he has successfully managed thousands of cases and performed over 2,000 gynecological and obstetric surgeries, transforming the lives of countless individuals. Ladies and gentlemen, permits me to welcome our Chief and Executive Director at Well Life Hospital and Well Life Foundation, Dr. Ibrahim Yakub Sime. Sir, the floor is yours. You can turn on your camera, unmute your mic, and begin your presentation. Thank you, sir.
Thank you. Thank you very much, Christine, for that lengthy introduction. I think that was more of a political introduction than. Anyway, not to waste our time, I hope everyone can hear me. Okay, so Christine has already introduced us, and I think I'll just go ahead to start talking about the topic directly. But I want to add that, well, of course, there is a reason we chose to start with this topic. As Christine has said before, infertility, it's not an often talked about topic in most medical fora or public fora because somehow, for some reason, people don't imagine that they will ever be victims of infertility somehow. I mean, there's this general belief that, well, when I'm ready to have a baby or a child, I will have one anytime. So but that's not really the truth. So we want to use this next few minutes or an hour or so to discuss um, what you need to know about your fertility. We look at the myths, as she has said before, the facts and medical realities. So permit me to share my slide so that all of us can participate in this.
Sorry,
I
sir,
don't
while
know.
you do that, I'd like
Yes.
to just encourage us. If we have any questions, please just drop it in the comments. I will be taking notes of it and the doctor will answer it at the end of his presentation. Thank you.
Can we see my slides, please?
Yes, very clearly, sir.
Okay. So, as a side, we're looking at the topic understanding your fertility myths, facts, and medical realities. And we're going to look at this briefly. We'll be looking at certain definitions just to place things in perspective. And then we'll look at factors affecting fertility, generally in both males and females. We're also looking at fertility myths, okay, and then fertility facts. Then, of course, we'll be talking about current medical realities concerning human fertility, and then we conclude. So at the end, if there are questions from the participants, from our viewers, and we will be entertaining as much as we can within the time we have. So let's start with a few definitions so that we can put place in perspective. Of course, all of us have heard the word fertility, but there are certain technical things and reasons why this definition is important. We say that the ability to conceive or to give birth to a child is basically your fertility. However, I want to add here that, of course, it is almost basically, I mean, if you have the capacity to bear a child, especially naturally without any artificial intervention, then we say you're fertile. Now, there is this subsector in this definition, which is subfertility. If for any reason you probably require some additional procedures or intervention before you can have a child, we say you're subfertile. Before I go to infertility, I'm sure, of course, the opposite of fertility, of course, is sterility, in which case an individual may not be able to have his or her own biological children for some reasons or the other. Now, infertility, on the other hand, is not the same as sterility. And I want to say here the definition of infertility. But technically, we say infertility is the inability to have a child or to conceive after 1 year of unprotected intercourse. Now, there's a caveat here. Usually, this definition of 1 year or staying up to 1 year before having been declared, I mean, you've been declared as infertile, is dependent on the age of the mother, I mean, of the woman. Now, for women above the age of 35 or 35 and above, the definition applies to them after 6 months of trying to have a child. Now, as we go along, we're going to see reasons why this is so in that situation. Now, reproductive age. The reproductive age, it's the age when a woman can get pregnant spontaneously. Now, we take note of the fact that it's a woman here. The reason being that by nature, women have their reproductive capacity defined largely by their age. And generally speaking, in medical parlance, the age that is considered as reproductive age for women is between the ages of 15 and 49 years of age. Now, for men, we don't have a limit per se, because generally, from the moment a boy or a young man achieves puberty, which is on the average maybe between the age of 12 to 15, up until when he's aged, he may still be able to give birth to, to father a child, but it's not the same as women. And so for a woman, we have an age range within which reproductive capacity is still active. So as we go along, we're going to see why this is so as well in the case of women. So my next slide is going to be talking about, we're going to be talking about factors that affect fertility, as it were, in both males and females. So we start with genetics. Genetics is basically the genetic codes or the software, as it were, that we inherit from our parents that eventually determine what we become in life. And of course, that is a very important factor that determines not just your fertility potential, but every other thing that you may be able to, whatever it is you become, as far as your physical structure and functionality of the human body as a whole is concerned, it's inherited from the parents. So sometimes there are certain genetic abnormalities or defects that may be inherited from either one or both of our parents that can affect our fertility. Now, this is very sad, of course. A child is born with inability or infertility from, as it were, from the very beginning, without him or her knowing that this was inherited from the parents. So there are a few examples. There's this one we call the cystic fibrosis, which if it so happens that your mother or your father or both of them have the defect and you inherit that, then of course one of the manifestation of that condition is infertility, as it were. So there are certain abnormalities that may also occur while one is in the mother's womb, that is in the formative stages of humans. And those ones are grouped into what we call congenital anomalies. Now, these anomalies, some of them in both males and females, and particularly in females, may interfere or affect one's potential towards fertility. Sometimes, while we're pregnant, if a woman is pregnant and is exposed to some substances, those substances may interfere with the formative stages of the baby in utero, that is in the womb, and may affect his or her fertility later in life. So it's important that while pregnant, as much as possible, pregnant women should avoid whatever it is that is unnatural, so as not to expose your baby to things that may affect his or her future. Now, age. Age is a very, very important factor that determines our fertility potential for both males and females. But of course, as I said earlier in my last slide, age is more important in females than in males. But of course, it affects both of the genders. Now, what does age do to us? Generally, of course, as we age, our cells, body cells age as well. And so that also includes our gametes, that is those cells that are responsible for procreation, for transmitting genetic material to the next generation. In the case of the male, it's the sperm. In the case of the female, we have the eggs, or what we call the oocyte. Now, there's one peculiar thing about women and the women or female, why the age is very important. Now, for men, I will mention briefly that the way God designed men, man can produce as long as he is alive, from the moment he attained puberty up until the day he dies. As long as he is alive, he can produce new sperm cells. Okay, but the new sperm cells may be affected by his age in terms of their DNA structure. Okay, so but as long as he's alive, he can always produce sperm cells. In the case of females, however, it's not the same. Females do not make new eggs in their lifetimes. I get really surprised when in clinics we mention this and then people are like, oh, I never knew that. So what happens in the case of the female is that a girl child is born with the number of eggs or oocytes she will ever have in her lifetime. Usually at the time of birth, usually the number between 2 to 3 million or thereabout. And these are the eggs that will carry her through her reproductive life. Now, sadly, however, as she grows from infanthood towards puberty, when she will start her first menstrual cycle or thereabout, or menarche, when she will start her first one, usually the egg population drastically reduces. We call it atresia. So they actually reduce to somewhere around maybe 2 to 3,000 less. So it is this number of eggs that will carry her through. Now, as she menstruates every month she sheds, so to say, some of these eggs are actually coming out and from the store, which is their ovaries, and they're getting wasted as long as she's not ready to conceive. And so the eggs that come out from that storage, which is the ovaries, never goes back and they get wasted menstrual cycle after menstrual cycle until when the egg pool in the ovaries get exhausted. Once the egg pools get exhausted, then of course that is the end of the potential for that woman to have her own biological children because she doesn't have any eggs anymore. And that period or that time period is what is actually at the time period that menopause sets in. So you can see why age is an important factor in the case of a woman. So in addition to the fact that the eggs are limited in number from the time of birth, they also age along with the woman. So it's a very important factor for us to think about. Then lifestyle. How does lifestyle affect us? Of course, there are certain personal habits that can interfere with our fertility, things like smoking, alcohol ingestion. These are they are just generally toxic to the gametes, in particular, both the eggs and sperm cells, such that when people smoke or take alcohol, we notice that in both men and women, they affect the quality of sperm or egg. Then nutrition. Of course, both obesity, nutrition, that is overnutrition or undernutrition and being underweight can affect fertility potential in the sense that obesity and being underweight as well tends to interfere with hormones that affect fertility directly. So it's important that we also consider our lifestyle when we think about fertility. Then there's this big factor, the environment. Environment is a very important factor in human health generally. Now, to the extent that no matter your genetic predisposition, or no matter what you inherit from parents, sometimes your environment, generally, that is your physical environment, can directly interfere with your genetic potential to either predispose you to things or prevent you from having certain diseases. So that also affects fertility. Now, we in recent times, a lot of research is now ongoing because I mean, from the beginning of mankind, as far as we can remember, especially for those of us who are religious in both Bible and Quran, you hear that there were people who never had children until way, way, way into their old age. So infertility has always been there with man somehow. So, and man has attempted over time to try and find out what exactly is going on, what can we do, what are the causes. Now, amongst other things, now it's becoming clear that our environment plays an important role. Now, for example, it's now shown that there are environmental toxins or chemicals, as it were, that we accidentally or sometimes deliberately get exposed to, and these things seem to affect our fertility potentials. For instance, just to mention a few, lead in petrol. Those who are maybe perpetually or continually exposed to petrol, the lead in it has been shown to affect both sperm and particular in men, sperm quality. In paint, the same thing. Now, for the ladies, of course, in our hair shampoos, there are certain substances that are known to affect our fertility potential. It's a very huge topic, what we call endocrine disruption chemicals. Then flame retardants in household items like your foams, meaning your mattresses, your calf,
Natto.
of
Spelling
course,
natto is soybeans. So they don't need to spell not kidney beans, not garbanzo beans, not kidney
can you hear me?
not soylent green, not Mr. Bean, garbanzo beans.
Can you hear me?
Yes, I can go ahead, sir.
Okay,
Sorry.
so there are a number of these substances that have been shown to affect us. So generally, the environment has been shown to affect. So no wonder before now, of course, there is this huge aspect of infertility we call unexplained infertility, a situation where you see a man and a woman, you've gone through, they are not able to have a child, they went through medical checks and everything seems to be okay, and yet they're not able to have children on their own until some assistance is given to them. So it's possible that some of these cases may have been because the environment, they are exposed to certain things in the environment. Then medical interventions or medical investigations and treatment. For instance, excessive exposure to radiation, like where unfortunately some people have cancer treatment. If cancer therapy includes or radiotherapy, and that radiotherapy involves exposure to the cancer around the ovaries or testicles in the case of man, then of course there's the potential for damage to the ovaries as well or testicles as it were. So that eventually may cause infertility or affect the fertility potential of the person. Then chemotherapy, of course. Chemotherapy is a group of is a type of treatment that's given to women who are, I mean, to people who have cancers, and this known to also affect fertility potentials. Then we come to infections. Of course, number one in this group is the STIs, that's the sexually transmitted infections. This amongst them, the one that I'm sure is common to many people are familiar with gonorrhea and then chlamydia. And those are the notorious ones actually that tend to affect the fertility potential, especially in ladies. Now, this is important because sadly, most ladies who tend to have this infection don't even know they have, because most of the time these infections come silently, insidiously, as we say, and they don't know they have it. Or even when they know they have it and they have symptoms, sometimes these things are poorly treated. And once they're poorly treated over time, they tend to affect the tubes, the fallopian tubes, as we call them, and eventually may block the tubes, and then the woman may end up with fertility issues later in life. Then in children, sometimes there's this mumps that may occur. Mumps infection. Mumps is a viral infection in children, and that usually commoner in people who are immune compromised or children. You'll see a child's jaw is swollen, either one side or both sides. Now, when it is very serious, especially in males, it could cause damage to their testicles at childhood, and that will give them problems later in life, fertility-wise. Then medical procedures. We've seen people who have had surgeries sometimes, especially pelvic surgeries around the genital areas, sometimes as simple as hernia surgeries in men, can sometimes be complicated by fertility impairment, especially where the surgeries were probably done by those who were not properly trained to do them, or where the surgeries were complicated by situations like infections, and eventually they end up with what we call pelvic adhesion. So that can eventually affect the fertility potential of such people. Then we have certain medical conditions in women. Endometriosis is one very huge problem that can affect fertility potential of the lady. Polycystic ovarian syndrome, it's becoming very popular or famous rather, and a lot of women, a lot of young ladies are coming down with this again for reasons we don't clearly know. But of course, it's becoming a huge problem affecting women worldwide. It seems to affect the capacity to ovulate and then therefore affect a woman's potential to conceive. Then hormonal problems. There are certain types of hormones. The imbalance or balance of such hormones can affect fertility potential. For instance, somebody may have maybe thyroid disease, uh, thyroid hormone issues that can indirectly also affect her fertility potential. Now, let's go to the myths. Now, when we talk about fertility myths, there's so many of them. There are so many of them, depending on the cultures, the society, people. In fact, some of these myths have both religious and cultural undertones. And so, I mean, when we talk about fertility myths, there are myriads of them. But the ones I highlighted here are those ones that we tend to hear often in clinics, in practice. So, but this is by no means exhaustive. So I'm going to talk about, I'm sure as we see them, we're familiar with some of them you are familiar with. Now, one of the very common myths we hear a lot of times is that a woman can get pregnant anytime she wants to. I'm sure we'll be shocked to know that that's not entirely true. That is not entirely true. Uh, that is an assumption based on, I mean, that is a statement based on assumption that the woman at the time or at any point in time she intends to have, she doesn't have any fertility problem. Unfortunately, fertility issues are only recognized when you attempt to get pregnant. A lot of young ladies, a lot of women out there, and men, of course, as well. I mean, there are men who boast that they can father as many children as possible, only to realize that when they start trying to get children, they have fertility issues. So the same thing applies to women. So it's not exactly true that anytime I want to get pregnant as a woman or anytime I want to father a child as a man, I can always have, because sometimes there are potential problems waiting by the corner. Then another myth that's common is being a virgin guarantees your fertility potential. It's not true. Okay. If you look at some of the factors we mentioned before we got here, factors that affect our fertility potential, you see that there are so many things that virginity does not guarantee. That doesn't. I mean, it does not. It's not in control. An individual is not in control of. Now, the only factor perhaps where virginity, being a virgin, can help to prevent is damage to tubes as a result of infections, especially sexually transmitted infections. So apart from this, among the myriad of factors that we mentioned, you find out that there is no guarantee that a virgin, for instance, will not develop uterine fibroids. We see it a lot. There's no guarantee the virgin will not develop endometriosis. There's no guarantee that the virgin did not inherit certain genetic abnormalities from her parents that may interfere with her fertility potential. And of course, there's no guarantee that being a virgin, you are not exposed to environmental factors that may affect your fertility. So it's important for us to know this. Then age is only relevant in a woman's fertility. Again, I've already mentioned this before. It's not true for men too. As the man gets older, usually the fertility potential drops because sperm abnormalities begin to surface as we get older. Infertility is only a woman's problem. Now, of course, again, this is very common saying, to the extent that if a couple gets married, in most cases, if no matter how long they want to wait, by the time they have waited, they have tried long enough, according to when and how long they want to wait. Usually, the very first person, and in most cases, the only person that first raises alarm is the woman. And that is because it is believed somehow Even the women themselves believe that, well, it's not the man's problem. So it is the woman that should. So in most cases, it's the woman that seeks help first. It's the woman that goes to the clinic. It's the woman that, does all the things relating to their fertility problems. Now, in fact, we see that women even present themselves willingly before marriage. In fact, we see situations where when a lady is preparing to get married, they present themselves to fertility clinics and won't tell you, oh, doctor, I just want you to check me. I want to be sure that I don't have any problems. And then you're like, okay, what about the guy? Are you sure he doesn't have a problem? Why don't you also subject him or tell him to subject himself to investigation? So there is this general assumption that it's only the women that have infertility or fertility problems. Another, sorry, yes. Another common myth is IVF is the only solution for infertility. It's not entirely true as well. Of course, before the advent of IVF treatment, there are other measures that can be given. Now, why I mention this is because in our clinics also, we encounter couples who basically don't even need IVF in the first place. And then because they were told and they believe that, okay, once we have infertility issues, the only solution is IVF, and they're not even aware that there are other measures that can be taken, and then they could probably, depending on their problem, they can have their children without necessarily having to do IVF. Then fertility problems can be solved by taking fertility drugs. Again, this is a very common practice among our women in particular, whereby someone assumes she has a problem, or if she identifies that she has a problem, she's trying to conceive and she is not able to conceive. She knows that her neighbor has taken a particular pill and gotten pregnant, not knowing the particular problem that the neighbor has, perhaps different from hers, and then she goes on to prescribe, or the neighbor prescribes something similar to what she has taken. And then, of course, in most cases, they only present to the clinics or fertility clinics when they see that such drugs don't necessarily work. So fertility drugs per se do not solve all fertility problems. You have to avail yourself to a place where you'll be properly investigated and then your problems identified and solutions preferred. Now, certain specific foods can directly impact fertility. Again, we hear this a lot, where someone will say, oh, go and take this particular thing, go and take that, go and take certain food, you will get a baby. That, again, is not entirely true. Then, other myths, prolonged use of birth control pills can cause infertility. Again, we hear people talking about this. They come to the hospital, they'll tell you, okay, of course, this is more common amongst people who have had children before and they want to rest for a while before they continue, and they will tell you, tell them, okay, I want to place you on a pill, and they will tell you, no, because if I'm on this pill, I may become sterile also. So that is also not true. Now, the other very common myth we hear is that ladies these days believe that they can freeze their eggs at any age and have a baby anytime they want. It's not entirely true. Again, I've mentioned from the beginning why age is an important factor, especially for a lady. So there are certain age, there's an age a woman will get, of course, that of course she doesn't even have any eggs to freeze in the first place, or if anything, the eggs are of very poor quality and they're few in number. So freezing such eggs at such age may not necessarily give her the best she intends to have. And so in this regard, we advise that for any lady who considers, who is thinking of perhaps freezing her eggs, it is better to do it early enough, preferably before the age of 35. That is the age at which it is considered that a woman's fertility potential declines very rapidly because of egg quality and egg pool. So anybody attempting or wishing to freeze her eggs, please, it is better to do that in good time. Then people also believe that certain sexual positions are better for conception. Of course, this is not true. In this regard, some people will come and ask us directly that, okay, doctor, if I want to conceive, I was told I should do it this way, I should do it this way, and all of that. But we tell them, no, no. As long as the semen, the sperm cells, is able to get through to the female genital tract, no matter what, it will get through and get to the eggs. That's all determines the conception, not necessarily any position. Now, frequent intercourse guarantees your chances of conception. Now, here I need to mention here, again, this is important where the couple, some people, I do not realize that in the woman in particular, a woman has only one day in the month in her menstrual cycle, so to say, to get pregnant. And that day is her ovulation day, precisely. Now, we need to understand that, yes, we have a lot of apps. We have, that is menstrual apps that tell you, okay, that show you your fertility period, so to say. In most cases, you see apps that will show you some green area. Okay, for those who want to conceive, that is those are the days you are more likely to conceive. For those who do not want to conceive, those are the areas you should avoid intercourse. Now, we need to understand that you don't ovulate every day in those period, or in that period rather, in those days. It is not as if you're going to ovulate from day 12, day 13, you ovulate. No, 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 no. Your ovulation period is just the period within which your ovulation day will fall, most likely. And that ovulation occurs in one day. And once the egg is released, it does not stay beyond 24 hours. So practically, every woman has one day in one menstrual cycle to get pregnant. Now, however, the reason the days are numbered that way and the days are considered as their fertility potential days is because semen or sperm deposited there too. Some sperm has the capacity to stay in the female genital tract for up to 72 hours, which means that days before your ovulation day, if you meet your spouse, there's a potential that 2 or 3 days earlier, the sperm will still remain there and you could conceive when you eventually ovulate. So practically, it is one day in the menstrual cycle. I used to joke with women that you have like 12 days in 1 year, because on the average, if you look at 28-day cycle, we have 12 months in a year, and so you ovulate 12 times, and then you have those number of days, 112 over 365 days. That's quite a very small potential. So, but that's the reality. So it doesn't matter, no matter how many times you meet your spouse after the ovulation day, that does not guarantee pregnancy. Now, again, the other myth is spillage of sperm after intercourse may cause infertility. That's not true. People don't understand that it's not the liquid, the semen, the water that fertilizes, is the spermatozoa that actually fertilizes. And usually once they're deposited, they swim away and go as far as they can while the water falls out. So that does not stop pregnancy. That is why sometimes even people who are raped, sometimes without necessarily having these, as long as the single sperm cells goes into the genital tract, of course, she could conceive. Now, what are the things that we know in fertility that are considered as facts that we need to understand and take home? Okay. A woman does not produce new eggs in her lifetime. I've already mentioned that. This is very important because, as I said before, we get surprised that people come to us in their 40s hoping to have children for whatever reason. Of course, in most cases, it's not their fault, but sometimes people deliberately want to postpone some of these things. And it is in this regard that we emphasize the fact that every woman should have this information at the back of her mind, that look, your fertility potential is not entirely in your control. So if you ever hope and plan to have a child, it is better you look at those factors that are in your control, perhaps deal with those that are not in your control, that is the fertility in particular, and then perhaps postpone the ones that are in your control for later, not the other way around, because of this reality. Your lifestyle and environment can affect your fertility. We have already mentioned that as well. This is a fact. And some women may never be able to carry their own pregnancies. Now, this is another fact, but as sad as it is, this is a fact. The reason that is so is because either from our mother's wombs, as we said before, or in the course of life, certain situations occur in the woman's life that will make her, that would affect her fertility potential permanently to the extent that she may never be able to carry her own pregnancies. But the good news in this case is that as long as the woman has eggs, viable eggs, to get her babies, then of course there's the option of surrogacy for her. That is an option of where the woman's baby can be carried by another uh, uh, lady whose womb is intact. Now, the other thing we need to understand is fact is that it is better to freeze embryos than freezing eggs. Again, when we're talking about the myths where we mentioned that women believe they can freeze their eggs anytime, yes, it is not, we said it's not true. But even when our eggs are good enough for freezing, usually the potential for eggs to recover after freezing is not as good as sperm or embryos. So at any time we choose to freeze our eggs, it is better if you have a partner that you trust, or sometimes if you don't have and you just feel that, well, it is better I just freeze my eggs at this point. You probably can get an anonymous donor, that is sperm donor, and freeze embryos rather than a egg. Now, there are two reasons why this is important. The potential, that is the capacity or how good an egg is determined by its potential to get fertilized. That is, at the end of the day, the ability of the egg to be fertilized and then to produce a quality embryo. Now, that can only be known when you fertilize it at the time. So sometimes when you freeze eggs, you do not know the potential of that egg until the day comes when you choose to fertilize it. So in the event that the egg is not really a quality egg, you only get to know much, much later when you are ready. So in that case, it is not actually wise. And then I also mentioned the fact that eggs don't seem to withstand the freezing process and recovery as good as embryos. So for those who want to consider that, it is important that perhaps you get or consider getting a partner who you trust. Now, here there's a caveat. The question they always ask us is, okay, what if the guy ends up not marrying you? Well, the truth about it is that if you eventually get another guy later, well, you could probably forget about this if you still have your potential intact, or you just tell him, after all, there are people who get married and adopt children. So this one was your own. If he's willing, you can go ahead and get that implanted into you and have your babies. Now, frozen eggs, semen, and embryos can be kept for several years. Yes, people ask us this thing a lot, that how long, doctor, can I keep my eggs, my sperm, or embryos? I mean, they can be kept for almost a lifetime, as long as the facility is available for the cryopreservation. We call that process cryopreservation. Now, the other fact is not all men who are sexually active are fertile. Again, the reverse of that was when we talked about men, we generally believe that women, infertility rather, is a woman's problem. Here, because there's an assumption that once a man is actually sexually active, he can father a baby. Is not exactly true, because sexual performance is entirely different from um, from the capacity to have a child. So that to the extent that even men who have erectile dysfunction can still father children through some means, certainly. Now, the other fact is that the older a man is, the longer it may take him to get his partner pregnant, again, because of sperm quality issues. Children from older men and older women are more likely to have abnormalities. Again, the reason is because the more we get, the older we get, the more our gamete, that is sperm and eggs, get genetic or chromosomal abnormalities, and then, DNA damages, and the children that will result from that may have abnormalities. That's a fact of science. Now, active lifestyle in both men and women can improve fertility potential. Again, if you remember when we're talking about factors that affect fertility potential, we talked about obesity and being underweight. So this is a fact of science as well. Taking certain supplements like antioxidants can improve fertility potential. Again, in this case, things like vitamin E, vitamin C, inositol. I'm sure for those who are in the fertility business, they see a lot of this every now and then. Then the other fact is children born via assisted reproductive technologies interventions are not artificial humans. We've had these things, concerns raised by potential parents who, for whatever reasons, need some form of intervention medically to get pregnant, particularly IVF interventions. Somehow, some people believe that IVF babies are not normal babies, they are not natural babies. But the fact of the matter is that IVF babies are as natural as any other baby. In fact, the process of IVF started sometime around 1978. From then till now, over 10 million babies all over the world have been born, and some of them have been followed up until now. And there is absolutely no difference between their life in terms of potentials and everything compared with people who were born naturally. The only difference between them and the natural conception is the fact that the egg and the sperms are fertilized outside, the baby is still returned back into the woman's womb. So they are not artificial beings. What are the medical realities as of today concerning fertility? Women in their 40s have a lower chance of conceiving per ovulation cycle. Now, a woman above 40 has just 5% chance of conceiving per menstrual cycle as compared to younger women who have up to 25% chance of conceiving per menstrual cycle. Older women also have higher chances of developing medical complications in pregnancy, things like diabetes in pregnancy, and older women also have higher risk of having babies with genetic abnormalities. What does this? And then ART success rates are lower in women above 40. Some women may conceive naturally or via ART, but may not be able to carry pregnancies in their wombs. Now, I've mentioned this before. This is a reality. Some women have wombs that have certain abnormalities that they can carry their baby. So there is an option of surrogacy. The other reality is that some men and women may not be able to have their own biological children. This is also a reality for some reasons I've mentioned before among those factors that we talked about. In conclusion, your fertility is not entirely in your control. As we have seen, many factors affect us, and some of these factors are not exactly in your control. So the way out is try as much as possible to avoid what is avoidable, and very importantly, start your fertility journey early. Don't give up until the finish line, and there are always options available that may solve your own issues. Ultimately, there is always a child waiting for ultimately, everybody will also have his or her own child in the end. So I thank you very much for listening. I hope we're able to, so we'll wait and hear if there are any questions from the audience. Thank you very much. I appreciate it.
All right. Thank you, Dr. Yakub. Thank you so much. Please, can we give him a virtual round of applause? If you look at the bottom of your screen, you can see a clapping hand. Yes, please, let's give him a round of applause. He's done his best to compress a whole masterclass for us in less than 1 hour, and we appreciate you, sir. So a couple of questions were dropped in the comments. I'm going to read them out one by one. You'll answer them. And then I will give room if there's anyone who has a pressing question, because I want us to be out of here in the next 10 minutes. We will give room for anyone who feels they need to express their question verbally. All right, the first question, sir, says from Asma. Asma is asking, does monarchism affect fertility potential also?
Sorry, does what?
Monarchism is spelled MONORCHISM. Monarchism. That's what's written here.
Okay.
Monarchism. Does it affect fertility potential?
Oh yes, of course. you see, monopism means you have one testicle. That's basically what it means. And of course, I mean, it affects fertility in the sense that, yes, sadly, there are people who were born with what we call undescended testicles, or one or both of them may not have descended. And where one descends, of course, the man's fertility potential is reduced by half because his capacity to produce semen is reduced by half. Now, the other challenge is if for any reason that one testicle is damaged along the line, of course, that is gone. So as against having two. So yes, indeed it does, and that is why when we check, sometimes we look at babies at birth, we want to ensure that both testicles are descended. And if they're not descended early enough, the surgery is done to make sure that the testicle is back into where it should be. This is to preserve fertility potential for later life. Yes.
Okay. Thank you very much, sir.
Yes.
All right. So the next question says, does ovarian cyst affect fertility potential? This is from Halima.
Oh, no. Ovarian cyst is actually, because there are different types of ovarian cyst, but the commonest ones actually are what we call functional ovarian cyst, and they don't in any way affect anybody's fertility, because in most cases they're actually a part and parcel of a woman's natural physiology. So the presence of them, to a large extent, does not affect fertility potential as well. The only challenge is when you have an ovarian cyst. Of course, in most cases, you'll be advised to seek help early to identify what type of cyst it is and remove, because not necessarily because of fertility, because of other potential health consequences that may come with. Yes.
Okay, thank you, sir.
You're
So the
welcome.
next question says, aside from genetic factors, what are examples of other factors that can render a woman unable to conceive completely?
Well, apart from, I've mentioned certain things. For instance, let me say
Yes.
a woman who we've mentioned some of the factors before, but because for the sake of answering her question or his or her question, I want to say that, let me say infection, for instance. Infection, STI, sexually transmitted infection, can affect potential to the extent that the woman will never be able to conceive, because certain infections can not only just block the tubes, they can also interfere with the lining of the womb to the point that the womb itself, there's this condition we call Asherman's. So once that happens and the womb is closed completely, of course, the woman will not be able to conceive. The other thing that could happen again is, I mentioned medical interventions. Some people are exposed to radiation. And once you are exposed to radiation wrongly, or in the place where your ovaries are, and the ovaries are damaged, of course, there's no way that woman will have her own biological children, except maybe by some form of donor arrangements where she can get eggs from a donor and then use them to have children, but they won't be her biological children.
All right. Thank you, sir. The next question says, from what age are women considered older? This is from Samira. So when we're talking about age, this question was dropped.
Yes.
So what age are women considered older?
Well, as I said before, generally, when it comes to pertaining to fertility, 35 years is that age above which women are considered older in fertility, right? Because it's at that age that the egg pool seems to dwindle very quickly, and then the quality of the eggs are also compromised by DNA issues and all that. So 35 years.
35 years. Thank you very much, sir. The next question says from Aisha, what's the best contraceptive method for a couple who are newly married but do not want to conceive immediately?
Well, in the first place, I mean, when young people approach me, I try to discourage them. I mean, from what we have said, I mean, childbearing is not a thing that you can beat your chest about and say, oh, when I'm ready, I can have a child, considering the fact that there are so many things that are not in your control. So, but however, if for whatever reasons, socioeconomic reasons, people want to, the best is usually looking at their medical condition in the perspective. So I wouldn't say there's no one size fits all for every person. The best is usually determined by a combination of your history and physical. And once you approach your physician, a doctor, he is then in a position to advise you to take a particular method. But right now, I can't really say that every contraception or a particular one is best for you until we see who you are and what your medical condition or history is like, including even your physique. Okay, those are things that will determine what will be best for you.
All right. Thank you, sir. So the next question says, thank you so much for this session, sir. What are the chances of having children in our 30s? Is fertility as low as it is in our 40s? Also, as single women in our 30s, what can we do to support our fertility until we are ready? This is from Oluwaseun.
Okay, well, yes, as I said, 35 is usually the age we consider as not too good for, but that does not mean that women, even in their 40s, would not have. Please, I want us to understand that we're only looking at statistics. We're looking at probabilities of getting pregnant. It's getting less and less the older a woman becomes. So women in their 30s, as I said in one of the slides, have as high as 25% chances of conceiving per menstrual cycle, provided they don't have any other condition that may negate that process. So now what to do if you go through the factors I mentioned as much as possible to avoid what you can avoid, to preserve your fertility. A lifestyle in particular, I tell people this thing, be as natural as you can, really. Avoid exposures to chemicals, toxins that may interfere potentially with your fertility. In the case of women, most products, unfortunately, that are fragmented, fragrances and all of that, most skin products, especially against blemishes, wrinkles, and a whole lot of them, can affect your fertility potential. So, in fact, to the extent that sometimes we advise women not to use those products while we are treating them for infertility and the rest of them. So, it's better to be as natural as you can while planning fertility, or if you want to preserve your fertility. That's the much you can do. And then start the journey early.
All right. Thank you very much, sir. So I'll take the questions quickly because of our time. Next question says from Blessing says, what is the next option for someone who was advised to go for IVF because of blocked tubes? That's the question.
Okay, fine. For anyone who has a blocked tube, who has blocked tubes, of course, the only option to have a child is IVF. So the next option is first for them to identify a center that they feel comfortable with, and then avail themselves. There will be a couple of other assessments or evaluations that will be essential for them, because blocked tubes or the presence of blocked tubes does not necessarily mean that probably other things may not be there. And so the next step is to get to a hospital or a clinic, a fertility clinic, and then begin your journey early, be evaluated, and then whatever it is that is identified apart from the block tubes will be addressed early enough.
Thank you, sir. Next question says, can fibroids cause infertility?
Okay. Well, yeah, usually this question comes and we say yes and no. Now, yes, in the sense that fibroids, whether or not they cause infertility, depends on their sizes and their positions. Now, position in the sense that if a fibroid, no matter how small it is, if it is situated within the cavity of the womb, sometimes it might cause the woman inability to conceive, because each time the baby goes there to implantation fails. So yes, in that sense, sometimes the fibroids are also in positions that they block the tubes. And in that case, if both tubes are blocked by fibroids, of course, the woman may have infertility. However, we've seen situations where women have very huge fibroids and yet they conceive naturally. In fact, sometimes it is during surgeries we identify that they have fibroids, especially where women never had chance to scan during the course of pregnancy. So they do not always cause infertility, but it sometimes can cause infertility.
Thank you, sir. So I'm taking so more questions are coming in the comments. After the next questions, I'll stop to take one or two hands so we can wrap this up. All right. Memuna says, what is the success rate of IVF for women between 35 and 40 years?
Well, generally, the success rate of 35 to 40 is about 10%, between 10 and 15% for most women. The younger women have as high as 40%, sometimes as far as 60. But the older you get, the lower the potential success.
All right. So the final question in the comments from Asma says, does sperm quality affect or hinder implantation in IVF?
Okay, not directly. Now we need to remember that at the point of IVF, once we are talking about implantation, it is not the sperm we're implanting, it's the embryo that came from the union of the sperm and the egg. And so where it affects implantation is the quality of the baby that results from that union. And so if the quality is poor, if the sperm quality is poor, the embryo quality may be poor. And where the embryo quality is poor, then of course implantation may be impaired. So yes, it can happen when sperm is of poor quality.
All right, so I'm just going to pause here. I can see different hands up. I don't know if all of you have questions. Ruth, Mr. Emmanuel, Hawati, Stacy, Mojisola, Zhang. If you don't have a question, please lower your hand. Ruth. Okay, if you don't have a question, please lower your hand so that I know who to call. Stacy, what's your question? Can you unmute your mic and quickly ask your question? All right, she doesn't seem to be right available. Hawati, can you unmute your mic and ask your question, please? Okay, moving on. Mojisola, is your hand up to ask a question?
No.
Okay, ma'am. All right, thank you. Zhang Beatrice, is your hand up to ask a question? All right. Gladys, is your hand up to ask a question? All right. Moving back to the comments, I'll take the last two questions from Halima and from Guangshak. All right. Halima is asking, what is the best way to get pregnant with blocked fallopian tubes?
Well, the best way to get pregnant with blocked fallopian is IVF.
Okay,
Well,
thank you. All right. Guangshak says, is candida or yeast infection a possible cause of infertility in women?
No. Candida is not considered as one of those causes of infertility at all in women. No, it's not.
Okay. Thank you, sir. Nasir, your hand is up. Is it to ask a question?
Yes, thank you.
Okay, please go ahead quickly. Thank you.
Okay, thank you very much, doctor. My question is, what cases leads to a chance of albino, as in the form of having an albino child? What sorts of deficiency leads to that, sir? Thank you.
Okay. Well, albinism is actually a deficiency in the gene that produces the melanin. That's the black pigment in our skin. So there are people who inherit that from their parents. And once you inherit that, you are deficient of that gene that produces the melanin or the substance that ensures that the skin is dark. So basically, it's a genetic abnormality that is inherited from parents, that results in that melanin deficiency, and then the child suffers albinism, basically. So it's something that is inherited from parents.
All right, Nasir, I hope your question has been answered.
Yes, thank you. Thank you very much.
Thank you very much. All right, thank you so much to everyone for joining us tonight. We will call it a night as we do not want to keep you. I will make a few announcements and then I'll hand over to Doctor to say any final words before we call it a night. You'd be pleased to know that this is just the first in a series of health talks. And so for signing up to be a part of tonight, we have your email addresses. And for as many people as consented to receive subsequent information about webinars from us, you will be hearing from us about subsequent webinars. We do hope to have this bi-monthly, that's every 2 months. So our next set of webinars should be coming up in May, and we encourage you to join us. Come ask your questions. It's free and we're hearing from experts. In case you also need more consultation, or you feel like you need just some consultation and some help with some of the things we've discussed, feel free to reach out to us at Wildlife Hospital in Abuja, 12 Biat Barra Street, we'll say, to Abuja, where also the foundation is located. The foundation, Wildlife Foundation, is also working towards helping underserved women, on their fertility journeys. And as we unveil our programs and projects, we will also keep you in the loop. I want to thank you very much for being a part of our webinar tonight. You made tonight a success. Over to you, Doctor. Do you have any final words?
Well, I would want to appreciate everyone that has come to participate. As I said, our goal is to, as much as possible, disseminate medical information, appropriate information for people to make use of, because we believe that at the end, as the general balance, we say prevention is always better than cure in everything concerning human health. So in this regard, we want to keep this up and as much as possible give out information that will help us prevent issues, generally fertility as well as any other medical condition. And we hope that all of us have benefited from this session, and we hope to see you again sometime in our next session. Thank you very much. We appreciate it.
Thank you, Doctor. You have so many thank yous in the comments. If you have time to take a look, we have so many of our participants saying thank you for an insightful session, for this great session. And we are grateful for your time, sir. Thank you for taking time out of your busy schedule to facilitate this session. I want to say a big thank you to everyone who showed up. Thank you to Mr. Emmanuel, our hospital manager, for being here. I saw Mujiba here. Thank you for being here. Shout out to our foundation consultant, Mr. Carl, who also joined the call and was here till the end. I look forward to seeing you at our next webinar in May. But for now, we'll say good night. And yes, our session was recorded and will be uploaded to our YouTube channel very soon. We'll also share the link with you so you can share it with your friends. Thank you so much, everyone, and have a wonderful night. Good night.